Hi, I'm Billy Ciaffretti, the founder of Ciaffretti & Associates Physical Therapy. If you're a competitive athlete, you may have missed your spring season, maybe the summer season, and have this unusual situation of an extended off-season, getting ready for the fall or the winter. I'd like to introduce you to someone who will be an excellent resource for you in the sense of reconditioning or handling and preventing injuries associated with getting back into shape with things. Marissa Riley heads up our sports performance program. Marissa has her doctorate in physical therapy. She has an advanced sports-specific certification. She is a certified athletic trainer and a certified strength and conditioning specialist. I'm delighted to have her on board. Marissa.
Hi everyone, my name is Marissa Riley and I'm a physical therapist here at Ciaffretti & Associates PT, and I head up our sports performance program here in the clinic and in some of the local high schools. So today I'm here to talk with you about what it means when you are deconditioned. So for many of us, we have either not been participating in our normal exercise routine, either because our gyms have been closed, access to pools have been closed, maybe you haven't been playing a spring sport if you're in high school like you normally would, and or your just activity level with being home for long periods of time has made you more deconditioned. So typically what happens to our muscles and to our joints when we're not as active is joints tend to get a little bit stiffer and muscles get a little bit weaker, which limits your ability to produce force, to move quickly, to react quickly, and then perform at your optimal levels of sport or whatever activity you're choosing to do. So what the research tells us over the past 10 or 15 years is that the more inactive you are, the higher your risk for injury. And we see this a lot in our runners, soccer players, football players, as they tend to get reconditioned for their sports season, is that the quicker you try to ramp up your activity level with higher amounts of hours dedicated to practice times or team-based activity in a short period of time after having a relative rest or deconditioned time period, that predisposes you to a higher risk of injury. So some of the common things that we will see in the clinic when people come in with an early season injury are shin splints, which typically affect the lower legs, the medial or inner border of the lower legs. And often that's from a drastic increase in mileage, of running mileage, of hiking mileage, of just running around on the sports fields. We'll see stress fractures in feet and in shins, hopefully not, but sometimes we see it in the femur and the hips, which typically happens for a similar reason from large increases in training mileage or training volume, different training surfaces. We see patellofemoral pain, which is just pain around the kneecap in some place on either one or on both knees. And again, a very similar trend tends to happen with increases in just overall activity happening too quickly. So that may be strength training related with too much load added too quickly, or too much time with running around and too much time dedicated to practices. We'll often see ACL tears, which are sort of the thing we don't really want to see and you don't want to experience as an athlete. And folks that return to pivoting, cutting activity too quickly without appropriate strength and balance, proprioceptive control of your muscles and joints. And then the other common thing that we tend to see is tendonitis situations. So a tendonitis is basically inflammation, and in more chronic or long-term situations that starts to lead to just some weakening of the tendons within, oftentimes that happens at the knee, that can happen down at the Achilles in the back of the lower leg. You can get some tendonitis situations in the hips, and in some of you that play throwing sports, that often happens up in the shoulders with some just repetitive activity, or again, lots of activity to the joint, which will either inflame it or start to make it weaker over time. So in our next video, we'll talk about some exercises and things that you can do to try to prevent some of these things from happening. So stay tuned and thanks for watching.